Welcome to USMLE Sarti. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
So, good morning, good afternoon, everyone. Welcome to this webinar. We are going to talk about telerotations, pros and cons. Should you do it? Who should do it? Does it really help your match chances, whether you're applying this season or in the coming season? And we are very grateful for two of our students who did telerotations, Dr. Mohib Ali and Dr. Neha, who are going to share their telerotation experience with you all, and then want to give more details around how to get prepared for telerotations, what is the difference, and how you can probably use it as part of your application and eventual interviews. So with that, let me turn it over for an initial round of introductions. So Mohib, let's go with you first.
Hello, everyone. My name is Mohib Ali, and I'm a US IMG from Pakistan. I was born and raised in the US, but I decided to do medical school in Pakistan, and I'll be applying to this match cycle. And thank you for inviting me, and of course, I'm open to any questions that you may have. I'll try my best to go through particular topics, and then from those topics, I'll expand, essentially. So thank you again. Appreciate it.
Thank you. Neha, let's go to you and get some introductions.
Yes, hello everyone. I'm Neha Mahindrakar. I am a non-US IMG. I graduated in July this year, and I'm applying for the cycle for pediatrics. And yeah, I'm very excited to be here and to answer all of your questions. I hope it's helpful for you guys.
Okay. So for those of you who don't know about USMLE Sarthi, go to our website. There is a list of rotations and research opportunities. And Kanika, who's on our team, maybe Kanika, you can post the link to our website for those of us who don't know. So we get started. Meanwhile, Mohib, let me turn the floor over to you, and you can take it away.
Okay, thank you. So I'll start with discussing my personal experience with the rotations that I did. So I did a telerotation with Dr. Coleman, who is affiliated with Rush University in Chicago. And so his rotation was very much focused on research focus and really on hard data. And so he would go through particular topics like hypertension, congestive heart failure, and different clinical cases, and then go through particular studies, and then expand on those studies, and we would explain and have a discussion regarding those. And so I felt it was it wasn't like slides or anything like that. It was more of a different type of approach of learning, and I felt it was beneficial because it was very much, he would always say, where's your data? Where's your data? So it was very informative, very good atmosphere with the different people who were attending the session. And Dr. Coleman was very, very humble, very great to be around, and it was a great atmosphere. And for example, like for hypertension, for example, he really emphasized that hypertension is not a number. It's based on, and some patients, they may be on antihypertensive medications. However, they're not on the appropriate one. And so some of those patients, even though the number may be at a good range, you're not giving the medication that improves long-term survival. And so those patients still go on to having chronic kidney disease and dialysis. And then I'm currently doing the telerotation with Dr. Atud and Dr. Wiseman, and that's from New Jersey. And so this one is a little bit different. So each telerotation that USMLE Sarthi provides you an opportunity to attend, each one is a little bit different. And so you can read on their website the description of each telerotation. And so, as I said, Dr. Coleman's was very much, he would go through each study. And Dr. Atut's and Dr. Wiseman was that I've attended, it's more you'd go through a different clinical case or a question. And then from there, we kind of expand on that. And there's kind of a PowerPoint presentation. For example, there was a clinical case regarding celiac disease that we had this a couple of days ago. And then we went through that clinical case of that real patient that had celiac disease. And then from there, I believe it was a Dr. Wiseman session. We expanded on that, and then he went through the bullet point presentation on that. And so each one is a little bit slightly different. And then based on, you can read the description and based on what your particular needs are or what you want out of your telerotation and different prices as well, you can pick whichever one suits you the best. And then also there's different time commitments as well. So the one with Dr. Atut and Dr. Wiseman, that's 1 hour. And then the one with Dr. Coleman, that was 2 to 3 hours. So it just depends on that. And overall, my experience with telerotations was it was a great learning opportunity. I definitely learned a lot. Certain things that I've learned from reading UWorld or different textbooks, things that I've actually genuinely never heard of. And so it really gave me different insights on common conditions, for example, like hypertension and others that things that I've just never heard of. And so it was very, very educational, very informative, and I definitely enjoyed it. I talked about, for example, blood pressure, but also, for example, genetic testing, with celiac disease, where we check HLA-DQ2 and DQ8 levels. And so with that, with our previous session we just had with Dr. Wiseman, he discussed that it has a very high negative predictive value. So if patients are negative for that, you can essentially rule out that celiac disease from those individuals. Things like abdominal aortic aneurysm, where a lot of people know that it has to be 5.5 centimeters, greater than or equal to 5.5 centimeters, but then many people don't necessarily know why that number is there. And so we had a session with Dr. I believe it was with Dr. Atut, where a program doctor in New Jersey, where he really went through a table and then explained that as it goes before 5.5 centimeters, the risk of rupture, 1 year rupture percentage risk is, I forgot the exact number, but it's much lower. And then after 5.5, it grows exponentially. And so that's why 5.5 is that number that we use. And that's why it's done. The surgical repair is done at that number. Also calcium channel blockers. There's I think misconception that Dr. Coleman was referring to, where people think that calcium channel blockers should be given to Asians or Southeast Asians or African Americans. And maybe some people are from India, so a lot of doctors maybe heard of that. But he said that calcium channel blockers are not this misconception that, okay, we should give calcium channel blockers to Southeast Asians or African Americans. That's not true. It doesn't improve long-term survival for those patients. So you would really go for an ACE inhibitor or an ARB as first line, not calcium channel blocker. So certain things couple points that I just didn't know. So it was very beneficial and very informative. So managing telerotations with other commitments, I found it to be very, very good. So the thing with telerotations is that it's a particular time of day. Of course, like there's 1 hour. Okay, this is the point of time where we'll be doing the telerotation. There's 2-3 hours of Dr. Coleman. Because I've also done some observerships and within the clinic setting at a local primary care physician, as well as also in the ICU. And so with that, the schedule is kind of all over the place. It's really dependent upon if a patient comes in, for example, in the ICU, or sometimes in the clinic it goes longer, and so or maybe it goes shorter as well. So it is very variable. But so I feel with telerotations, if you have a lot of other commitments and other things that you're doing, it's very beneficial because it's only about 1 or 2 hours or maybe a couple hours, and it's very a fixed, a regimented type of schedule. And so if you just allocate that portion of your day and make sure that that's free, and then you can do other things as well, of course, like studying for steps or, revising your personal statement. But with clinics and an ICU, it's kind of the entire day. So I would say that telerotations are very good if you have other commitments that you want to do. And also the other benefit with telerotations is it's cheaper as well. So I know that some of you may have a question regarding, I'm a US IMG, so I live in the US, but why did I do telerotations? So if I were to do, major reason was because of the money aspect, because if I were to do and be traveling to different states, it would just be a lot of money. So I decided that it would be better to do kind of a mixture. So I've done at a local clinic, which, and then also, South Dakota or Minnesota, and then also some telerotations as well. And then it's also different, that you have a different experience when you do telerotations versus in person. With telerotations, it's obviously there's a presentation, there's a clinical case, and then you learn from that way. But when you're doing in person or seeing patients in a clinic or an ICU, you learning from seeing patients, and you kind of you ask questions from the attending, and then you write it down. You're, oh, okay, that was interesting that I learned. Oh, that thing that I learned. And you also learn how to kind of work as an interdisciplinary team, and you see how as a hospitalist or somebody who's working in the ICU works with the nurses or works with other, for example, neurosurgeons when you're in the neuro ICU. So you see that collaboration and that interdisciplinary approach that you don't necessarily see in a telerotation. But then in telerotations, you definitely learn a lot of different insights as well. So it's slightly different. And so some of the tips that I would recommend for a successful telerotation would be, first off, obviously it's good to come on time and make sure that you're very attentive and stay engaged throughout the session. Some people and the program directors and the people, for example, Dr. Coleman, Dr. Tu, Dr. Wiseman, they pick up on that. And so the people that are more engaged and that are more answering questions, asking questions, they're more likely to give you a better LOR. Obviously, if you haven't really participated in the session, there's like 50 or maybe 100 students. If you only maybe about 5 to 10 are participating, then they may not remember you as much. So it's good to try to as much stay as engaged and really attentive throughout the session. It's also good to take notes as well. So I would recommend not doing it on a phone. Some people, they would do it a Zoom session on their phone, which if you're on a time constraint, that could be, or maybe you're traveling or something's going on. That's of course understandable. Everybody has different circumstances and stuff. But I would recommend trying to do it on a laptop. That's better because you can first off, the screen is bigger, so you can kind of see certain things. And if for example, Dr. Tudor or Dr. Wiseman is presenting a clinical case on a PowerPoint, you can just see it better as opposed to, on a laptop as opposed to doing it on a phone. And then also taking notes is a lot easier as well. I did one time do it on my phone a couple of times, and I didn't find it, that session wasn't as good for me because I wasn't able to take notes as well as I did on the laptop as well. And so another thing that I want to mention is that it's a good opportunity for you to network and get connections and exchange contacts with other individuals from from the session from other parts of the world. So, we're all trying to match, of course, and it's good to just have other people that you're have connected with and are exchanging information with, that you can help each other after the telerotation as well. So it's good to just network and get more connections with people. And another thing that I feel like some people, it may be the reason why some people don't necessarily engage or participate in the session, is because they feel as though they may be wrong from the doctor. For example, Dr. Coleman would ask certain questions, and so some people are apprehensive to participate or try to answer that question because they feel as though if they said something wrong, that will be held against them. But Dr. Coleman really mentioned when I did it last month that it's okay if you're wrong. He just wants to see that you're engaged and that there's something that it's better than not saying anything. So you can have that good discussion with the doctor, and then if you're wrong, they can correct you and then change any mistakes or misconceptions that you may have about certain things. So it's really just we're all just to have a discussion and just to be open to have that conversation about that particular whatever we're discussing, whether it's celiac disease or hypertension or whatever it may be. And then also another point that I want to mention about Dr. Coleman is that he also mentioned the importance of having a sense of like camaraderie amongst physicians. And he mentioned that when you're like in an internist, some people have this mentality of, I want to be right, so I won't tell another person an information that I know because I want to be the one that's right, and I want to put myself apart from others. But he really mentioned and emphasized that if there are certain things that you know and certain information that that you should share with others, and so that we can all grow and all improve. And so having that camaraderie and that amongst team members is very important as well. So lastly, the application process for the rotation. You can go on, starts number one with going onto the website, and you can check on their website and there's a filter, so you can see which state you're looking for, whether it's telerotation, in person. This is a telerotation session, so you would click that, of course. And then each one has the doctor's, I don't think it has the doctor's name, but it has a description of the doctor, the description of the rotation, the state it's in, and then a particular telerotation number. And so you first apply to that telerotation, and then they will send you an email about 1 or 2 days later, telling you, I think it's actually about 1 day, telling you whether or not the rotation is available or not. And then after that, you'll apply to that rotation by giving them, it's approximately, I believe it's $156 application fee for that rotation, and you'll pay for that after paying for that invoice. Or after paying for that $150 application fee, then you pay for the full invoice, and you have to make sure that you pay for it prior to starting the telerotation before it starts. And then after you pay the full invoice, you'll likely contact with another person that is helping the physician with the telerotation. For example, with Dr. Coleman's rotation, it was Toya Banks who was helping me kind of facilitate the process to start the rotation. And so after paying the full invoice prior to the start of the rotation, then you'll receive an email confirmation, and then you'll get a Zoom link for the rotation session with its respective timings, and then make sure that you save that Zoom link. And sometimes the Zoom link may be the same or it may be different. So for Dr. Coleman's rotation, it was the same Zoom link that you used throughout the whole month. But for Dr. Atut and Dr. Wiseman, it's different. There's like 2 to 3 different, because it's I'm not sure necessarily why, but I think it's because it's a different doctor or a different, maybe that's the reason why. But so you just have to be mindful of the Zoom link. They may be different, and then also the timing as well. Make sure, because with Dr. Atut, Dr. Wiseman, one starts at 8, and then one starts at 7. So one person missed it because they had the wrong timing. So just make sure that the timing correlates. You're able to convert it to your own time depending upon where you are in the world. So I know I talked a lot, so those were a couple of points that I wanted to mention. Hopefully I didn't miss anything, but of course.
No. Thank you very much, Mohib. This was great, and you really laid out how to do well in these rotations and all. And I will, maybe after this session, I'll walk you through, for those interested, on where the website is and the process. There is, I think, one question, but we'll get to that towards the end, and other questions. But now let's move to Neha. Neha, talk to us about your experience and what you thought of the telerotations, and how do you intend to use it in your eras.
Yeah, Doctor. Hi. I actually have something I would like to share. So can I do that? Hi, everyone. Yeah, this is just a brief introduction. I think we've done that already. I graduated in July this year, and I'm applying for Match 25 for pediatrics. Okay, so yeah, this is obviously what we're discussing today, telerotations. So yeah, my personal experience with telerotation, I misspelled that. Sorry about that. Yeah, I'm currently doing a telerotation that I acquired through Sarthi, and it's at the Bluegrass Family Medicine and Pediatrics Clinic in Lancaster, Kentucky. It's a 4-week telerotation. I started on July 29th, and I think August 22nd is my last day. So yeah, this is just a description of what our schedule is. We meet with our preceptor 3 times a week, Monday, Tuesday, and Thursday, and it's 10 to 5, so 10 to 3. So that's 5 hours, and it translates to 7:30 to 12:30 in like IST. There are about 10 of us, coming from different, like with different ages, different parts of our USMLE journey. Some of us are applying for the first time. Some of us are applying to pediatrics. Some of them are applying to IM. So it's a great. I think one of the first things I took away from this rotation was the sense that we're not alone on this journey, because everyone is scared, everyone has their own questions, and it really helps when others ask their doubts. So it helps clear what you didn't even know, you wanted to know. And what we basically do is we're on a Zoom call constantly with our preceptor, who's Dr. Sheshta Ren. She's a pediatrician. And we get to observe how she takes histories, and she does physical examinations. She has some students over sometimes, and we get to observe how students function in the US healthcare system. So it's a really great glimpse into how their system is different from ours, because this is my first telerotation. So yeah. Also, yeah, one other thing is we get to closely observe how an EMR works, which is, I think, like one of the most important things as a non-US IMG, because we, at least in my hospital, work on, written notes. We don't have a tele documentation system. So the EMR, she is very gracious. She lets us ask as many questions as we want about the EMR, about the match process, and it's a great session. I feel like it's a great experience for me, and yeah, I'm really enjoying it. So that's about, yeah, how do I find telerotations? This basically, yeah, let me go to my next slide. Yeah, these are just, after weeks of research, I think, are the 3 like email addresses I could find off of Reddit and Twitter and other websites where you could just email these things, these places directly. The second one is University of Miami. The others are clinics. And this is a shockingly, less number of places you can apply to for telerotation. So what you can do is you go to these great agencies that are there to help the IMG community. And you can just compare. I compared for like a long time, and I think USMLE Sarthi was the best in terms of how much flexibility they offer in terms of the rotation dates, and also I think they're the most affordable. So you should go check it out if you're aiming to do that. And yeah, how can this is obviously a big question, especially as an IMG, because we already have so many stacks against us on top of, so these are, I think, the 3 most common reasons that you could say to your interviewer if it comes up. And visa rejections is the most common according to my research. But the good news is that I've heard a lot of PDs know about the high rejection rates in countries like India and Pakistan, where I think a lot of IMGs apply from. So I think they would be pretty understanding if you tell them that your visa has got rejected. And one point that I would like to put forward is I haven't had my visa appointment yet, but I think the most common reason why visas get rejected is because most of us are graduates, who are applying 1 or 2, 3 years out of med school. And I think the visa office is really careful about the fact that you would just go there and like maybe just get into their system and start working. So you just need to prove that you have strong ties to your home country, whether in terms of you get a job or you buy a property in your name. You just need to prove that you have a strong reason to come back. And I think you should be okay. Financial restraints, as Dr. Ali also talked about this. So yeah, obviously it's a big expense going there. On top of the rotations, you're paying for everything, food, rent. I think according to my calculations, it would take anywhere from $3,000 to $5,000, which is not a small amount of money. So that's a very, very valid reason you could, save money on rotations. And applying immediately after graduation maybe is not a very common reason out there, but it is a reason that I have to not have gone for in-person rotations. I graduated in July this year, and so the applications close in September. So I had like a couple of months to acquire rotations, to sort out my visa issues, and I just couldn't do that in time. So which is why I went for telerotations. Yeah, the cons of doing a telerotation, obviously, I don't think we need any discussions. It's not as great as doing in-person rotations. If you could acquire in-person rotations, you probably should choose that over doing a telerotation, because it just gives you more time with your preceptors, with your peer, and just like a better insight into the healthcare system there. And obviously, you can make a more impactful, imprint on your preceptor and get maybe a better LOR. I can't speak because I haven't done in-person rotations, but that is the common, like perception. And also, like some good news though is that doing a telerotation and having an LOR is better than having no LOR though. So if you have a valid reason of why you've done a telerotation, you should definitely do it. The only disadvantage will probably come at a point where you're pitted against another candidate with similar stats. You're shortlisted by a program, you have similar scores, similar visa statuses, but that person has an in-person rotation and you have a telerotation. That is probably when this will be a disadvantage to you. But yes, you should definitely consider it if you have a valid reason, as I said. Yeah, this is probably been explained by Dr. Ali. He has experienced it on his own. So I am really in no position to say anything because I am not doing anything at the moment. I'm only doing my telerotations and working on my application. So, but I do have a lot of my colleagues, 6 or 7 out of 10 of us are postgraduates. They're SRs in their own countries. They're working in the day, and they're doing telerotations in the night. So I really think you can do it. And this is really the crunch time. So you don't want to, take your foot off the pump right now. So if you can maybe fit in a telerotation and get an LOR out of it, you should probably consider it. Yeah, these are just some things you should definitely dress well. There are very few points on how we can impress our preceptors on a telerotation, and you should not lose points on how you dress. Don't have like messy hair, or even though they can only see maybe 1/3 of our bodies, just look sharp and be early. Yes, I mean, they may come late sometimes, they'll inform you, but you don't want to keep them waiting. And yeah, stay late. I mean, I did say that mine is a 5-hour rotation. It usually ends at 12:30 in the night. But sometimes, there'll be a patient in the lobby. She'll tell us about some interesting case that's going to come in like half an hour or 40 minutes. And you want to show your enthusiasm. You don't really have a reason not to. So you should go out of your way and maybe, I don't know if they'll add points, but I really think what do you have to lose if you do that? And yeah, be proactive, as Dr. Ali also said. They have a lot of people there with you. So it is tough. It's weird to I mean, I also have a lot of social anxiety, but I think you really have to, you only have 4 weeks to impress them and make an impression. So you should be proactive, ask questions. Don't worry about stupid questions. They don't have to be clinical questions. They can be anything about it's a new system for you. EMR is new. Everything is new to you. So you will have questions. So don't be shy to ask them. Yeah, these are some things that, yeah, oh, my preceptor actually told me this. I don't think it applies anymore because we only have a month left into this season, into the deadline actually. But if you can get a rotation and you have the opportunity to extend it by a week or two, you should do that rather than cramming 2 rotations into, these 6 weeks. Because my preceptor said that it would give you like more time to build an impression and it would generate a more personalized LOR. So I don't have any experience with that, but that's just verbatim what she said. So you might want to think about that. And also, yeah, save money is just, there are a lot of there are a lot of agencies out there and they're charging absurd amounts for a telerotation. But that's what I said. Sarthi is actually like doing well in terms of how relatively affordable their rotations are. So you should compare before you apply. Compare. There are a lot of filters. If you want states, costs, dates, there are any amount of filters you can apply. But yeah, be wary of how expensive some of them are. So yeah, that's it from my end. So thank you.
Thank you. This is very helpful. So, I know Mohib, you've been answering questions on chat. So, if there are any other questions, feel free to put in the chat, and Mohib or Neha can answer. And otherwise, I can give you a quick demo of if you're looking for rotations, where to go. So, any questions? When can I get my LOR? So if you are doing rotations through Sarthi, there is a form that should have come to you. We ask you to fill that form, and then we work with the preceptors. You should be, if you've already finished it, you should be getting it end of August. If you have not received a form, email our team at enroll@usmlesarthi.com or contact. I'll put in the email, and you can write to us. Okay, so maybe Neha or Mohib, you can answer how to write Tele experience in IRAS. You're on mute, Mohib.
I'm not sure. What do you mean? Do you mean like how do you describe it, or how would it be different from in person? I guess it just depends on whatever for example, in Dr. Coleman's, it was more where he would go through particular medical conditions, and then he would go through the relevant research. So like, 1999, this research article came out, 2005, this came out. And so he would kind of sequentially go through all the different research from 10, 15, 20 years ago, and then go through it all. For example, explaining hypertension, congestive heart failure, and explain how when each research paper came out, our understanding and management of that condition changed. And so he gives you really a good overview of all the different data. And then with Dr. Wiseman, it's more different clinical cases. And that's more like online didactic sessions where he has with other residents as well. So Dr. Coleman's was, there's no other residents there, but Dr. Wiseman, there's other residents that are there. And it's also interesting as well with Dr. Wiseman, you can kind of see and interact a little bit with the residents that are in the US as well. And so that's a little bit interesting as well. So I guess I suppose maybe Mr. Pavan could maybe answer that a little better, or maybe Dr. Neha. So I guess it just depends on which telerotation you're doing and what you did in that rotation. Yeah.
Yeah, so I think a lot depends on the type of telerotations, didactics versus patient interaction versus, what you are actually doing. And it's different from different preceptors, as Mohib said, Dr. Weissman to do it differently. Dr. Korea on our team does differently. Dr. Coleman and others do differently. So it all depends. But as long as you can, like Neha also mentioned, show and demonstrate your learning and your enthusiasm and ask the right questions, I think you can still make it work. If of course, if you have more questions, this is what we pick up your telerotation and do it in our classes and help you with your PS and CV both. So that's why, it's very difficult for me to tell you what exactly given your situation. Neha, did you have anything to add to that?
Yes, somebody has asked if we need to indicate that it's a telerotation in errors, and I think definitely you should, because you should be extremely transparent in your errors application. I mean, you can maybe not add it, and if it doesn't come up, then they'll just treat it. They wouldn't even know it's a telerotation. But if it does, then you really need to describe what your experience was and what you did during those rotations. So I think it's better to be transparent and upfront from the beginning. So
yeah, I'll take a couple of other questions that I see in Q&A. As a non-US IMGs, how can I participate in any research while not living in the US? So we do have research courses that you can look at, and there may be other research courses, all remote research. Kanika, maybe you can post our research courses link that they can look at. Then someone is asking, 2019 graduate, step 1 status is passed, CK is 236, no research experience, planning to apply in the next season. How much is the chance of matching? What do I do to increase my chance of match? So the good thing is you seem to have time. I mean, you're not applying this season, you're applying next season. So might as well set up a free profile review with us. We can go over it. But overall, obviously, there are some standard things you need to do, US clinical experience, depending on the specialty. Research may or may not be relevant. And, some of those things, you have time. So, we can definitely discuss that. All right. Any other question? Okay. If there is no other question, let me share my screen quickly for those of you who are interested in, looking at how to book telerotations. So I'm gonna show it to you in a minute. So, and Kanika can give this website. So basically, it's residencymatch.usmlesrthi.com/rotations. Hopefully you can see my screen. There are some instructions. Read that because they are important. And once you read it, then you can actually filter, by specialties, by type. So type would be telerotation, hands-on, observership. You can also filter by state, and you can also filter by inpatient, outpatient, those kind of things. LOR types, whether you are getting it on a clinic letterhead, hospital letterhead, those kind of things. Sometimes we run offers. Some of these are program director rotations. So all of that you can see. And once you do that, you can, do the filter button if you want. This is not filtered. So for each rotation, you can actually see the details. If you click on details, you will see the city, state, zip code. It helps you in planning your stay, etc. You'll see the fee, you'll see the application fee, if we provide visa letter and all that. So all of that is available. And then you put an approximate start date here. And by default, most of the rotations are 4 weeks. So if you want more than 4 weeks, you can let us know, additional comments. And when you click check availability, an email comes to our team, and then they work with the preceptor to check the availability, and they tell you if it's available for your start date. And if not, they'll give you alternate dates. So that's how very quickly, how our rotations work. There's a question. I'm thinking of applying to neurology in addition to, I guess, IM to increase my chances. Should I apply to neurology, or do I do a telerotation in the same? So I think each specialty will look for specialty specific experience and LOR. And if you're applying to IM and neurology and you don't have anything in neurology, it'll be a good idea to do at least one rotation. There's not much time left. So do a rotation in neurology. If you cannot do online, if you cannot do on-site, then I guess do it online. But yeah, without a neuro rotation, it'll be hard to match or get selected for interview in neurology. Okay. With that, that I think was all that I had. Those of you interested in our match plan, so there is some discount going on. This is being extended for a couple of days. So take a look if you are interested. I think Kanika will post that link as well. So that link, if you go to. The other thing which I do want to mention, because a lot of you are always asking about volunteering with a US based organization. So we have collaborated with a nonprofit called Teen Heal. We have a session with them tomorrow. So if you are interested in volunteering remotely for an organization, this is the organization. We will have a session tomorrow for IMGs. I'm going to put a link to the to the webinar for tomorrow. Yes, so Sneha, I think Kanika has already put it. So just take this last link. That is for the webinar tomorrow if you are interested in volunteering and adding to your ERAS experiences. Is the discount available only in groups? So the group discounts are the most attractive. If you, there are groups of 1, 2, 3 also. I think after the weekend, the group discount will not be available, but they are the most attractive. I think there's a group of 15 or something that we already met. Okay, any other question for us? Well, if there are no other questions, thank you very much. And thank you, Mohib and Neha, as our esteemed speakers. I appreciate your time and, your sharing of the experiences in Telerotation. So thank you very much, and good luck to both of you for the upcoming match season.
Thank you. Thank you for inviting me
you.
to be a speaker. I appreciate it. Yeah.
Thank
Yes,
you,
same
and
here.
everyone have a good weekend.
Yeah. Thank you.
Thank you.
everyone.
Bye.
Bye-bye.
Bye.
Bye-bye. Thank you.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.